one of the most important things for us is your pain management and comfort post-operatively, because obviously you're worried about it. Everyone gets scared with surgery, mostly because of the pain that is associated with this. So we really want to control that and focus on it so that you're comfortable with what we're doing. One of the problems is that when you come into the OR, you're already in pain, partly because of the intervention that you're going to get, but partly because you weren't able to take your anti-inflammatory before the surgery. The anti-inflammatories cause bleeding, and the bleeding can affect our surgery, so we really don't want to deal with that. So while you have a little bit more pain before the surgery, we want to make sure that we minimize the amount of pain during and after the surgery. So because of that, and for the bigger procedures, we definitely give you blocks. The blocks are with a bunch of different medications, and there are different types of blocks. Whether you do a peripheral block, which means around the skin and around the deep tissues, or a nerve block where you specifically identify specific nerves, we will do that to try and control your pain. At the surgical center, we have an excellent anesthesiologist, and we have ultrasounds so that we can use the ultrasound to identify the nerves and specifically block those nerves. That goal is to try and decrease the discomfort you have postoperatively and also decrease the narcotics that you take. We do need to get you on the narcotics, but we want to get you off of them as soon as possible, so we will somewhat limit the amount that you take, and we will augment with the blocks, with anti-inflammatories, with muscle relaxants, with Tylenol, and so we do a multimodal therapy depending on the size of your surgery to try and make you as comfortable as possible. With the narcotic medication, a couple things. Number one, you may get nauseated and you may not want to eat much, but also you may get constipated. And so the constipation is a big issue post-op, and so we really want you to fight it hard with staying very hydrated, drinking plenty of liquids, not drinking alcohol. You can take the anti-inflammatory medications to help out, but we also want you to take something like Citracel, Metamucil, Miralax, something to keep things moving. It's also okay if you get up and walk around, because that will help that as well. One of our biggest complaints post-operatively is just that. So we really want you to focus on that. It's on our discharge instructions, and so we really feel that's important for you to know that. Also, after the surgery, we're going to give you the instructions post-operatively, and once again, they're on our website, so you can get them there if you lose the ones that we give you at the time of the surgery. You will have a dressing on, and the dressing may be a large dressing or small dressing, depending on what surgical procedure you have. Our discharge instructions will indicate what you have to do with the dressings. Sometimes you can take them off the next day, sometimes it's 2 days, sometimes it's 3 days, or a week. What we want you to do is when we allow you to shower, we want you to take the dressing off, put waterproof Band-Aids on it, and take a shower. Do not bathe, because if you bathe, it can sometimes soften the skin so much that it macerates. And so we really want you to try and protect the wounds, and we will give you instructions in the post-op instructions as far as when to take the dressings off and when you can shower, because those are the two most important questions that people ask. So we will be telling you what the dressing protocol is, when you should take them off and when you should use them, but we also will tell you about movement and weight bearing. So for certain surgical procedures, we want you to protect your weight bearing because we do not want to disrupt the reconstruction that we did. But oftentimes we'll always have you doing some partial weight bearing or full weight bearing. And so all those instructions will be on the discharge instructions that are available at the surgical center and also on our website. And we will also instruct you as to when to take the dressing off.